In 2022, COVID-19 is still a threat to populations in Africa. Less than a quarter of all people are fully vaccinated against COVID in sub-Saharan countries. The pandemic and other health outbreaks such as cholera or Ebola make it more difficult for governments to provide essential healthcare services to those in need. A lack of cold chain infrastructure such as refrigerated containers, cold boxes, freezers or refrigerated vehicles limit the ability of some countries to conduct vaccination campaigns. Since the onset of COVID, WFP has leveraged its global footprint and logistics expertise to help coordinate and support the response to the pandemic. WFP has procured, stored and transported more than 130,000 cubic meters of critical relief cargo on behalf of humanitarian and health partners, while strengthening health supply chains in collaboration with partners from the public and the private sectors, such as Takeda Pharmaceuticals. In 2022, WFP and the Government of Japan are partnering to further enhance the response to COVID-19. Through a $5.6 million grant and building on years of collaboration with Ministries of Health, WFP is procuring essential cold chain equipment, enabling innovative cold chain solutions and strengthening local supply chain capacities.
Over the last few years, WFP as the co-lead of the National Transport and Logistics Cluster has been supporting the government of Malawi with a wide range of logistics services and most recently the response to the COVID-19 pandemic. We've been supporting partners by storing essential medical supplies, setting up screening areas in airports, isolation and treatment centers at health facilities and container labs at border posts.
As we go along, we see that the WFP has got so much potential to actually participate in the transformation of the supply chain in Malawi.
Malawi by itself cannot manage all these epidemics or emergencies that come along. To do that, we forge partnerships. There is UNICEF, there is WFP, and many others that come to help Malawi build the capacities as well as manage the disasters.
Thanks to the support of the Government of Japan, cold chain equipment such as pharmaceutical-grade refrigerated containers or freezers are being provided to 9 African countries, including Malawi, and key storage and cold chain infrastructure built in Somalia, with a new medical warehouse set up for the Ministry of Health in Mogadishu. A transport training centre, TTC, is also being built in Accra, Ghana, in collaboration with other partners to train logistics actors from the public and the private sectors on key supply chain and cold chain management fundamentals. By strengthening regional and local capacities and capabilities, WFP and the Government of Japan are working together to help ensure that COVID-19 vaccines are effectively delivered and available to the most vulnerable populations, while making supply chains strong enough to efficiently respond to future health emergencies.